Have you ever woken up feeling more tired than when you went to bed with a heavy chest, stiff neck, swollen legs, or even a racing heartbeat? What if the way you sleep every single night is quietly putting extra strain on your heart? And what if one simple change in your sleeping position could actually help protect it? Most seniors never think about this, but doctors and sleep specialists have been paying close attention to it for years. As we get older, sleep is no longer just about rest. It becomes deeply connected to heart health, blood pressure, circulation, breathing, and even brain function. And tonight we're going to talk about one sleeping position that may help your heart work a little easier while you sleep. Welcome back to Dr. Waterling Hub, where we break down important health topics in simple, practical ways to help you stay healthier and feel better every day. Now before we begin, this video is for educational purposes only and is not medical advice. If you have heart disease, sleep apnea, breathing problems, or any serious medical condition, always talk to your doctor about the best sleeping position for your body. Let's start with something many people don't realize. Your heart doesn't stop working when you sleep. In fact, nighttime is when your cardiovascular system finally gets a chance to recover from the stress of the day. Your heart rate slows down, blood pressure naturally lowers, and your blood vessels relax. But your sleeping position can either help that recovery process or make it harder. And for seniors, this matters even more. As we age, the heart becomes more sensitive to pressure changes, circulation slows down. Many older adults develop issues like acid reflux, snoring, sleep apnea, high blood pressure, or swelling in the legs and feet. Some even experience nighttime shortness of breath without realizing their sleep posture could be contributing to it. That's why doctors often ask heart patients a surprisingly simple question: how do you sleep? Now here's the interesting part. Many people assume sleeping flat on the back is the healthiest option. Others curl tightly on one side without thinking twice. Some even sleep sitting halfway upright in a recliner because it feels easier. But according to many sleep and heart experts, one position tends to stand out for seniors, especially those concerned about heart health: sleeping on the left side. Yes, something that simple. Now before anyone panics and throws out their favorite pillow, let's talk about why this position may help. Inside your body, your heart sits slightly toward the left side of your chest. When you sleep on your left side, gravity may help improve circulation and reduce pressure on some major blood vessels. For certain people, this position may also help blood flow more efficiently back to the heart. Think of your circulatory system like a highway. If traffic moves smoothly, everything works better. But if certain positions create pressure or resistance, your heart may have to work a little harder. And during sleep, your body notices those differences. Some seniors also find that sleeping on the left side reduces nighttime acid reflux. That's important because reflux can disturb sleep, increase stress hormones, and even trigger chest discomfort that feels frighteningly similar to heart problems. Another major issue is breathing. Poor breathing during sleep puts extra strain on the heart. And many older adults unknowingly experience mild airway obstruction while sleeping flat on their backs. When you lie completely on your back, gravity can cause the tongue and soft tissues in the throat to fall backwards slightly, narrowing the airway. This may worsen snoring or sleep apnea symptoms in some people, and sleep apnea is not just annoying snoring. Repeated breathing interruptions can reduce oxygen levels, raise blood pressure, and increase stress on the cardiovascular system night after night. That's why some people notice they breathe easier on their side, especially the left side. Now, does that mean left side sleeping is perfect for everyone? Not necessarily. For example, some people with certain shoulder problems, chronic pain, or specific heart conditions may actually feel uncomfortable on the left side. Pregnant women are also often advised to sleep on the left side because it improves circulation, but seniors have very different health considerations. The key point here is not perfection. It's reducing unnecessary strain on the body while improving sleep quality. Because here's the truth many seniors don't hear enough. Bad sleep quietly damages health over time. Poor sleep increases stress hormones. It may raise blood pressure, it can affect blood sugar, memory, mood, and inflammation levels. And over months or years, all of that matters. Sometimes people focus only on medications and forget the body heals best when sleep improves too. Now let's talk about another sleeping habit that surprises many older adults: using too many pillows. At first it sounds harmless, maybe even comfortable. But stacking multiple pillows under the head can bend the neck forward too sharply and sometimes restrict breathing or create neck tension. On the other hand, sleeping completely flat may worsen acid reflux or shortness of breath for some people. That's why many sleep specialists recommend gentle elevation, not extreme elevation. A supportive pillow that keeps the head and neck aligned naturally is usually better than piling up several pillows randomly. And if you sleep on your side, placing a pillow between your knees may help reduce pressure on the lower back and hips while keeping the spine aligned. Small adjustments can make a surprisingly big difference over time. Now here's something else important. Many seniors wake up multiple times during the night and assume it's just normal aging. But sometimes the body is trying to tell you something. If you wake up gasping, coughing, sweating heavily, or feeling your heart racing, don't ignore it. If you regularly wake up exhausted despite sleeping for many hours, that's worth discussing with a doctor. And if you need to sleep sitting upright just to breathe comfortably, that can sometimes signal underlying heart or lung issues that deserve medical attention. Your sleep position matters, but so does paying attention to warning signs. Now let's discuss the sleeping position that may cause the most problems for some seniors: sleeping flat on the stomach. For younger people, stomach sleeping may simply cause neck pain. But for older adults, it can sometimes place extra strain on the neck, spine, and breathing mechanics. Turning the head sharply for hours at a time may reduce comfort and disturb sleep quality. Some people also experience more pressure on the chest while lying face down. That's why many experts generally prefer side sleeping over stomach sleeping for seniors. And there's another interesting detail most people never think about. The quality of your mattress matters too. An old mattress that sags in the middle may throw the entire spine out of alignment. That can increase pressure points, worsen joint pain, and interrupt deep sleep cycles. You don't necessarily need the world's most expensive mattress, but if you wake up stiff every morning, or if your mattress is over 8 to 10 years old and visibly sagging, it may be contributing more to your discomfort than you realize. Now, if you're finding this information helpful so far, make sure to subscribe to Dr. Waterling Hub, youtube.com, for more simple health tips designed especially for seniors and adults who want to protect their health naturally. And let's talk about something many cardiologists quietly emphasize: consistency. Your body loves routines. Going to bed at wildly different hours every night can disrupt your internal clock and affect heart health over time. Studies have linked irregular sleep patterns with higher risks of blood pressure problems and metabolic issues. That means the healthiest sleep position in the world won't fully help if sleep itself is chaotic. Simple habits matter more than people think. Dim the lights before bed. Avoid heavy meals late at night. Limit excessive caffeine in the evening. Reduce screen exposure before sleep. Keep the bedroom cool and quiet. And most importantly, listen to your body. Sometimes seniors force themselves into uncomfortable positions because they heard it was best. But pain and discomfort create stress too. The goal is supported, comfortable sleep that allows the heart and body to recover naturally. Now, let's clear up a common myth. Some people believe sleeping on the left side can crush the heart. For most healthy people, that's simply not true. In fact, many individuals feel perfectly comfortable on the left side and may even breathe easier in that position. However, certain people with advanced heart failure or specific medical conditions may feel uncomfortable lying on the left side because they become more aware of their heartbeat. In those cases, doctors sometimes recommend adjustments based on individual symptoms. That's why personalized medical advice always matters. But overall, side sleeping, especially left side sleeping, is often considered one of the more heart-friendly positions for many older adults. And here's something fascinating. Researchers have noticed that sleep posture can even affect the brain's waste-clearing system during sleep. Some studies suggest side sleeping may support the brain's natural cleaning process more effectively than some other positions. So this isn't just about comfort anymore. Sleep posture may influence multiple systems throughout the body. Now imagine this. You spend roughly 1/3 of your life sleeping. That means even small nightly habits become powerful over time. A healthier sleeping position won't magically erase every health problem. But improving sleep quality, breathing, circulation, and comfort night after night may help the body function better overall. And often, it's the small daily habits that quietly shape long-term health the most. Before we finish, here are a few simple tips many seniors find helpful tonight. Try sleeping on your left side with a supportive pillow. Avoid sleeping completely flat if you struggle with reflux or shortness of breath. Keep your neck aligned instead of bending forward sharply. If side sleeping hurts your shoulder, try a softer pillow or alternate sides carefully. And if you experience unusual nighttime symptoms like chest pain, severe snoring, breathing pauses, dizziness, or swelling, talk to your healthcare provider. Never ignore persistent symptoms just because they happen during sleep. Your body speaks quietly before bigger problems appear. And one final thought: a good night's sleep is not a luxury. For seniors, it becomes part of protecting the heart, the brain, the immune system, and overall quality of life. Sometimes the smallest changes create the biggest improvements. So tonight, before you fall asleep, pay attention to how you position your body. Your heart may thank you for it, and if you enjoyed this video, make sure to subscribe to Dr. Waterling Hub, https://www.youtube comms at _source =chatgpt.com. Give this video a thumbs up and share it with someone who cares about staying healthy as they age, sleep better, breathe easier, protect your heart, and remember, healthy aging often begins with the habits we repeat every single night.